So I'll just do the formal introductions now. Thank you everyone for joining the Support Hub session today. As I said, we are recording the session. I'm Tahmina and I usually co-host these sessions with Sue Jones, but I'm on my own today with Dan and Trish. And if there are any kind of questions that you have while Trish is presenting, you can either kind of raise your hand after the presentation or put questions in the Q&A, and myself and Dan can keep an eye on that and answer any questions that we can. So Dan, over to you if you want to do the formal introductions, and then Trish can start sharing her slides. Thank you.
Thanks, Tahmina. Good afternoon and welcome to today's Support Hub session. We're focusing on research grants and mastering the application process. So for those of you that don't know me, I'm Dan Kearns, the IBMS West Midlands Regional Council member and a practicing biomedical scientist with a background in cell path and histology. I'm also an active member of the NHS Research Ethics Committee, which is partly why I'm here today. I'm employed by University Hospitals Birmingham as the head biomedical scientist in the Centre for Liver and GI Research, which is a translational research facility housed at the University of Birmingham and supported by the NHS Trust. We're joined by Professor Trish Lalor, who is Professor of Experimental Hepatology, who's going to give us an overview of the grant application process. So without further ado, I'll hand over to Trish and we'll have some time for questions at the end.
Lovely, thanks very much, Dan. So I'm just going to try and share my slides. Bear with me a second. So hopefully you can see everything. I think I can see people nodding, so that's good. Thank you very much. So good afternoon, everybody, and thanks to the IBMS for this invitation today. So as you heard, I'm just going to tell you a little bit about how to master that kind of scary grant application process. So I'm an academic at the University of Birmingham, but I'm also part of the NIHR infrastructure, and we do have to put these kind of silly biographies together when we're part of the NIHR. But I thought for the purposes of today, I'll just give you the headlines as to why it's me that's been asked to give this presentation. So going back into the dim and distant past, I did an undergraduate degree in applied biology, as it was called in those days, but it would be called biomedical sciences today. And as part of that, I had the opportunity to take a year out between year sort of 2 and 3 and do a year in industry. So it was an academic-led project delivered by a company in Oxford called Yamanouchi Pharmaceuticals. Went really well. I got a real taste for research at that point. So that's why I decided to go back in and do a PhD. So I was able to work with the academic supervisor for that project, get some funding, but I did a PhD in immunology. Back in Birmingham. And then after that, I've done a series of sort of postdocs and lectureship positions all the way through to where I am now as a professor of hepatology. So I am an academic. I do teach at the University of Birmingham. I do all kind of admin and sort of early career researcher mentoring, but I am a researcher by training. And so in that sort of regard, I have experience in the grant application process. So I have secured both little small pots of money, but also some larger scale funding. And because of my background, that's tended to be from things like the research councils in the UK, so Wellcome, BBSRC, for example, other research charities, the National Institutes of Health Research, European research funding, but also little funds from industry partners. So I've got experience of different types of research funding, but also a benefit for the discussion today. I sit on grant committees, so you get some insights from that process, which are very informative. But also in my role in the university, I'm helping younger researchers actually put the grants together, mentor them through things like grant clinics to actually get funding. So I know what it's like to be at that side of things as well. So hopefully that's going to come in useful today. Just to give you a little bit of background about where we are. So I'm based at the University of Birmingham. So this is the nice aerial picture here. So we're in the little orange building in the middle, top floor of that building is the liver labs, but you can see we're right across the way from the liver unit at the hospital. And the reason that's important is because the lab where Dan and I work is a really nice mixture of people like me who are scientists by training, but also people like Dan that work in the NHS. So we do have BMSs within our team that help deliver our pathology service, but also we have clinical academics working in the lab. So we do span that space both from the academic research all the way through to the clinical research. So let's get to it. Let's thinking about the grant application process. And I'm just looking at this slide now and thinking it's actually a bit grim. It's a bit negative to start with. But essentially, I wanted to give you the message from the beginning that it's a challenging financial environment. Everybody's competing for funding. Funders have actually got less money to be able to give out. So there will be a point where you apply for something and you won't get it. But I think one of my biggest take-home messages for today is to not sort of dwell on that too much. There's lots of factors that are completely outside of your control. So funder thresholds for funding, external factors in the committee that you can't do anything about. So we'll give you some tips today to write the best possible application. But at the end of the day, sometimes it was just never going to make it. So don't take it too personally if you don't get funded in the first round. And sort of as a bit of a joke, I put on this image about this recipe for success for a grant application, but actually there's some good messages in there. So, persistence and hard work are a big part of that, but also there's an element of luck involved and an element of opportunism, essentially. So seeking those opportunities and actually going for them in order to get your funding. Be sort of flexible and creative about what you go for. And also I've said use your network. So you'll have people around you in the places where you work every day that will be able to give you help. So use them. People are happy to give you help on these kind of things. So if we go through and think about now the actual application in process, the first question that you have is, where am I going to send this grant? And actually, it's not as simple a question as you might think, because generally, in my experience, funding appears from sort of two routes. So either you have a great idea and you put it down, and then you think about the funder to whom you can send that great idea. So the person that's most likely, or the scheme that's most likely to fund that research. But also there are situations where, particularly if you work in somewhere like a university or maybe an NHS trust, where opportunities are advertised, maybe on newsletters or email drops, you might see an application offer that you haven't thought of before. So there you might be repurposing an idea to fit a specific call. So the sort of criteria for those two different scenarios are slightly different. So think about, how that impacts on how you're going to put this grant together. But also it's important to think about what the funder wants from you when you put that grant in. So they may have particular strategic objectives or particular goals that they actually want to achieve by funding research. So you want to make sure that you position your grant to answer their objectives almost as well as your own. And a little example of that, I'm assuming that a lot of you are working in the kind of clinical laboratory setting where you might be using some quite nice technical instrumentation platforms. And often people who make that kind of equipment will be offering almost like beta testing funds, if that makes sense. So they may have a new all singing, all dancing single cell sequencing platform, and they may offer out small pots of research money, maybe up to 50 or 100,000 to actually test that in a real world setting, generate some data and then give them some feedback. So in that situation, obviously, it's all about the resources that are available to you to help them test that platform. So think about what they're after when you're actually putting your grant together. The second point I made on this slide is, how long will it take to write it? And I don't mean to be sort of flippant or glib when I say that, because you're all busy. You're all doing multiple things outside of work, in work. Grant writing, to do it well, takes a certain amount of time. So you need to work backwards from the deadline to make sure that you have time to get everything done and put it in. And I say this as a devoted Captain Chaos. I am absolutely a do everything at the last minute kind of person, because I think that adrenaline helps me focus a little bit. But I try not to do that in the grant context, simply because it's often not just about me. So usually when you write a grant, you might have to go through some kind of institutional approval process, which takes time. And that person who's pressing the button for you might have 40 other grants to submit on that day. So you can't risk leaving it to the last minute and then making their lives a misery or missing that deadline. But also you may need other elements outside of you to actually get the grant. So you may be looking at getting some kind of ethical approval. You might need some kind of NHS approval or costings. You might need contracts to be put in place between multiple institutions to allow you to do this work. And all of that takes time. So if you leave everything till last minute, there's a chance that you will not meet those objectives and you won't be able to submit. So think about the timing. And that brings me on to the next point, is just, who do I want to work with, or who do I need to work with? So my advice to you would be to work with people that add value to your project. So they're bringing something important to allow you to deliver your objectives. You want to work with people that you know or trust, because particularly if you need them to do something, you want somebody reliable to actually work with. I would also say, it's not very official, but people that you like, people that you get on with, particularly when you're doing a very complex research project, it's always helpful if you can just bring up the phone and go, what the hell are you playing at? Let's do this, this and this. So try and build a rapport with the people when you put your consortia together or your partners together. but they need to be people that genuinely bring something to the project, particularly if they're costed in or they're offering a skill. The funder will want to know what they're doing. But I've also put people you need to work with. So there may be situations where you need project management support or finance support or clinical trials unit support. They may be somebody you don't work with every day, but you need to engage them to deliver your project. So in that case, engage with them early as you're putting the application together, so they're with you as you put the application in. And then next point, I've said, read the guidance. Obviously that's an obvious statement, and there'll be a few of those as we go through this presentation, but it's really important not to make any mistakes, miss a deadline, miss an appendix or something that the funder is looking for, or make silly mistakes that mean you get triaged out at the first stage. So really do read the detail. And then ask a colleague to help you. It's very difficult to be vulnerable and send somebody a draft application to read. You want to get it all pretty and perfect before you send it to them. But actually, it's good to get advice early, because they almost play the role of a member of the committee that's reviewing your grant. So they'll spot things that you haven't spotted, and they'll be able to genuinely give you advice. So do ask your colleagues for help, I would say. So let's think about the detail of the application as you work through the process. And I said to you at the beginning, obviously, I tend to get applications which are often quite large scale from people like UKRI or ERC or industry, which are big and complex grants. But I'm aware that some of you might be starting smaller. So after these couple of slides, I've put in some nice examples of funding specifically from the IBMS to try and pick out some of these things as we go through, to give you examples of why I'm making the points I'm making. So the first question is, who is actually going to read this application? So who is on the committee that's judging your application? And they are likely to be experts in their field, probably. So there will be people there that know exactly what you're talking about. They're likely to be very busy. So you need to make sure that everything is clear and they can read it and understand it straight off. But equally, for many funding panels, they are made up of a mixed discipline bunch of people. So some of them will not be experts in your area. So there, the advice would be to write it for them. So if you use a lot of abbreviations in your work, the NHS is notorious for that. So is science. We love an abbreviation. If it's not immediately obvious to somebody who doesn't work in your area, just define it so that they know exactly what you're talking about. So sell the grant so that it's clear to somebody that's technically experienced, but perhaps not the expert in your specific field, and it's more likely to have a good run through. The second point I've made is sell, sell, sell. And what I mean there is that funders, they only have so much money to give. They want to know that the money they give is going to get used for benefit that's relevant to their strategic objectives and is going to have a good outcome. And so what you need to do is think about that all the way through when you're putting your story together. Pick a hook. Maybe you're looking at a new test that will improve the management of patients with a particular condition. Think about that as the sell all the way through. How are you going to help those patients? Who are those patients? And how is your specific test going to actually do that? So sell the impact all the way through, because you're in competition with other grants or other applicants, and they want to fund something that's going to have a genuine impact. And related to that, you need to tell the people who read your grant why you're the right person to do this. So you need to use things like the CV, and also there might be narrative bits of the application that you fill in to show that you're at the right career stage and you have the right experience. Maybe you have the right team around you and they have the right experience, so you can actually do what you say you're going to do. And in some cases, you almost want to say, I'm the only person that can do this because. So really sell your experience and the environment you're in to demonstrate why you should be funded, particularly for things like those career development awards. It's really all about you. But the other thing you need to evidence, if you can, is why the way that you're going to answer that question is correct. So the methods that you're going to use, the samples you're going to use, the equipment that you're going to use is state of the art. It's the right thing to answer that question, to reassure people that you're going to get the outcome that you're looking for. And it may be, I work in an interesting sort of intersection between cutting edge, really crazy laboratory based technology, and technology that's at scale for the NHS. So it may be that there's a fancier way to answer a specific question, but it wouldn't roll out to scale up for patient testing, point of care testing. So sometimes you might be saying, I'm doing a simpler test, but it's because I want that impact. I want it to be feasible in the patient setting. So tell the readers why your approach is good, and tell it as a nice, compelling story. Again, remember that competition, tug at their heartstrings, tell them why this is the problem. I'm the person that can solve it in this way, and this is what's going to happen at the end. If you keep reflecting on that, have a narrative throughout, it makes it really, really good to read. And I'm going to say this several times, but get people to review it. Look for feedback from your peers, colleagues, maybe people who've sat on similar committees, people who work for that funder, if you know them, that might be able to tell you what their strategic priorities are. Get as much feedback as you can. Often institutions like universities, sometimes in the NHS setting as well, you'll have things like grant clinics that you can present your ideas at, and then people will give you feedback as if they were on the panel. It's really valuable. And I've put one example in here. I know this slide is really ugly and text heavy, I apologise, but it makes a very simple point, which is that the funder that you're applying to may also offer you support to put your application in. So this is one example from the NIHR. So they have something called the Research Support Service. So you can contact them really early, even before you've drafted your application, because they do things like advising on research design, methodology. If they can't fund it, can they tell you somebody else that could fund it? And how do you involve patients and the public in that kind of research to make it impactful? So have a look to see if your funder has this kind of support. Also things like program managers. So places like the MRC, Wellcome Trust, they have sort of program managers that are responsible for each of their research schemes. You can usually contact them early, even when you've just got an idea, and ask them, is this fit to remit? Is this something that this particular funder would fund? And if it isn't going to fly at this particular call, are there any other calls within your funder that this might be eligible for? And actually that builds a relationship between you and the funder that can be very valuable. They're expecting your application then if you've spoken to them. And so it sort of helps you through that process for these particularly for these kind of larger scale applications. So really do get as much help as you can. So let's think about the detail of actually writing the application now. And I've said it before, but it's really important. So timing is key and planning is key. And it plays back to that idea about who else do you need input from? Who do you need to contact early to get specific information? So many grants, and I'll give you some examples a bit later on, you write the sciencey bit, the justification bit, but there's usually extra things that you need to add. So this may be very detailed financial costing, for which you're going to need financial input early on. They may want you, particularly if you're going for those more kind of career development type grants, they may want you to add letters of support from your previous mentors or supervisors. You may have to go through ethical review, particularly if you're involving patients in your research, or there may be internal review processes at your university or research home to triage applications, so only the good ones are going through to application. And usually, it's not always the case, but very often is the case, is when you finished your grant, you press a button for the funder portal. It then gets sent to your host administrators who check the detail. So is the funding adequate? Have we got the space to do this? Are the samples there? Is it ethical? Is there any legal or IP or compliance issue that means that we're not comfortable delivering this? So they will check all of that kind of stuff, and then they're the ones that press send to submit it to the funder. So that can take time, particularly when they've got lots of applications coming in on the same day, as I said earlier. So it's not just about the bit that you're writing. There may be other people involved. And one good tip here, so letters of support, I quite often get asked to provide letters of support for people that I may have worked with 2 or 3 years ago and who have subsequently perhaps moved on to another job and are doing new things. So I can talk about what they used to do and what experience they had then, but they may have new things that I'm not aware of. So a good trick, if you're getting a letter of support from somebody who's a busy manager of research, when you ask them for that letter, give them some pointers. I've even seen examples where people almost mock up a letter for me, which puts the details of who I'm going, where the funding's going, what kind of things, what's the broad outline of the application, and these are the skills that I have, so that then I can write a very tailored letter of support. And when you're a busy manager, that's great. It means I don't have to go into my email and look up emails from 25 years ago to work out, what I'm going to say. It's all there. So that's a good tip. If you can, liaise with your mentors and help them write that letter of support. The other thing you need to do is do your research into the landscape of the project. And I mean two things here. So firstly, do your research about the funder to make sure that your project fits with them, but also it sort of tickles up their strategic priorities, so they're more likely to fund it. Also, what kinds of things have they funded in the past? How do they assess their applications? Is it committee? Is it one stage? Is it two stage? Be prepared so that you know exactly what you're going into. But also the scientific or the research or the medical landscape of your project. If you're proposing something which somebody has done before, you're not going to get funding. So make sure you're aware of the environment in which your project sits, because as a reviewer, that reassures to me that this is somebody who's engaged, they know what they want to do, they're familiar with the literature, it's likely to be an impactful project. So do your research before you start putting it together. And then, as I said, you need aims and objectives. So these are the things that you're going to do to answer your nice research question. You probably want 3 or 4 of them for the average grant application. Reviewers will look at your ambition. So you should be ambitious, particularly if you're working in a team or you're addressing a really big, meaty challenge. Be ambitious, but don't suggest things that are impractical. So a reviewer will spot if you can't do what you can say you're going to do within the time, or if you have asked for too much money or too little money based on these objectives. So be realistic and practical in terms of what you think you can achieve with your budget in that specific time frame. So that leads into this point here about budget. Make sure your budget is realistic. If, say, your threshold for funding is £100,000, don't ask for more than £100,000, obviously, but also if you can deliver the project for £50,000, then ask for that, because often a funder may have, say, £500,000 worth of money available and people are applying, and it may be that after funding some others, there's 50,000 left, and then your project goes up the list for funding. So ask for what you actually need. And also spell it out. Tell the reviewers what you're going to spend the money on. So if I get a grant that says, oh, I need, I don't know, £30,000 for lab experiments, I'm thinking, well, what are they going to do? Are they going to buy reagents? Are they buying time on equipment? Are they, paying somebody else for CRO type services? If you spell out exactly what you need, so a detailed budget, it tells me you've planned well, you know exactly what you want to do, and you've thought about the project itself and maybe any risks around it. So it subconsciously gives me the message, oh, this is a good project. This person's really thought about it. So be detailed in your budget, but also how you're going to monitor whether it's worked or not. Particularly sometimes grants might have 2-stage funding. So you fund the first bit, and then if it all works, you get the second bit of funding. How do you know the first bit has worked? So tell the funder how you're going to measure outcome, particularly if you're working with lots of different people. How do you know that each bit is working together to deliver that objective? So describe your approach to monitoring, and that might actually relate to how you're handling data as well. So if you particularly if you've got GDPR sensitive data on patients, for example, how are you going to anonymize that? How are you going to store it safely and securely? How are you going to share it with partners if you are going to do that? And how long do you retain that data? So things like data management plans are really important, but also communication plans. That might be how you tell your partners as the project is evolving, whether everything's working and what you've all got to do. But it could equally be, how are you going to tell the scientific community afterwards, or the medical community, about your results? So are you going to share data live? Are you going to write lots of papers? Are you going to engage in working groups, that kind of thing? Tell people that if you get the opportunity to do so, because it plays back to the funder. Oh dear, I've just got a message saying me that my computer's going to restart, so hopefully that's not going to happen, but we'll carry on. So yeah, so the funders want to know that the results of their investment are going to be disseminated. So that's quite important. There may be situations where one element of your work is a little bit risky, and that's fine as long as you acknowledge it is and perhaps suggest a strategy that could step in if the original plan doesn't work. Again, that shows a person that you're being creative. And again, proofread, ask people for help. The reason I say this, I know it's obvious, but on a committee, if you get a grant in that's full of spelling mistakes, the links don't work, the references don't match, the figures have the wrong numbers, all the rest of it, I'm thinking this person's either done this at the very last minute or is completely disorganized and hasn't taken enough care to put the grant together. And then I'm thinking, how much care are they going to take with my money to actually do the experiment? So it's surprising how much of a negative impact lots of spelling mistakes can have. So really do get it proofread. And sometimes you just don't see them anymore. So this is where asking your friend to proofread might highlight areas for you. So I've got 2 examples now where we can put all of that into practice. So the first is a current one from the IBMS. They're funding this nice scheme for activities related to Biomedical Science Day. So promoting biomedical careers. And if you look on the website, you can see here there's an application. It closes the 19th of May, so you know when it's going to finish. And they're looking for some of those things that we just talked about. So they want a realistic application with a good, clear budget. They want it to be creative and innovative. So it's not just doing what hundreds of people have done before. It's something nice and new. And importantly, that it's raising awareness of biomedical careers. So that isn't something you would necessarily always put in unless you thought about that. So you want to make sure you capture that. And then the budget's here clearly stated, £500, and they want communication afterwards. So you need a plan in there for how you're going to give them pictures back and write a report at the end. And if you look into the detail then on the website, some of these are coming up again. So raising public awareness, but they go a bit further. Role in prevention, diagnosis and treatment of infectious and disease. You'd want to bring that out in the narrative. Lots of activities they'll fund, and they give you examples. Resources for doing experiments, maybe with the public, renting space to do that, things like careers events, marketing, giveaways, things like that. So your budget should play to those kind of activities. And then they also make the point that although there is a day, which is Biomedical Science Day, they're acknowledging that you may not be able to do an event on that day, so you can spend the money up to 30th of September. So they'd want you to articulate clearly when you're going to spend your money. And this is another example. This is one of the bigger funds that's available from the IBMS. So this is their research fund now. We're talking about £100,000. So it's a more complex application, but it's still online. And this would be a tip for you here. There is nothing worse than when you have to type directly into those online portals. It's really tricky and it's hard to assess word count and things sometimes. So usually when you have a situation like this where you're typing or uploading directly into a portal, there's often somewhere on that website an opportunity for you to download what the questions are. So you can always get your text ready beforehand and then drop it into the application as you go through. So if that's available, take advantage. It's a good tip. So for this £100,000, they're looking at career progression type outputs, but also environmental sustainability. So you want to be writing your narrative around one or two of those areas. They say there's some criteria here. So you've got to be an IBMS member, or at least the lead applicant has to be an IBMS member. So if you aren't, you're not going to get funded. So things like that are important. And then they also give you nice examples of what you can't apply for and what you can apply for. So you want to make sure your budget meets those. And if you look into the detail of this particular grant, it's similar to some of the others that you will see out there, some of the other examples that I've given you, in that there's a section about the project, there's sections about the money, they want the structure of the project and how it's going to run, so the kind of management type of bit. And then there's all of the due diligence at the end, so there's signatures and acknowledgements, that kind of thing. But it gets tricky. 500 words for many of these sections. It's quite hard to write everything you need in 500 words. So I would say write it on a separate document, just write, put in what you want to say, and then edit afterwards to cut it down to the 500 words so that you don't miss anything important. So here they want the background of the project, how it aligns with those chosen themes. So that would be either your career development or your sustainability for your lab. They want the aims and objectives. And then there's this bit here. How does this address the aims of the IBMS workforce plan. So this is where that research comes in. I would Google this workforce plan, see what it is, and make some commentary about how you fit with that when you're writing this particular section. So the research about the landscape is important here. They're talking about success and failure. So this is this risk mitigation idea. How do you measure it, but also how can you get around it if risks come up? And then all of this ethical approval and due diligence comes in at the end. There's also sections around important dates. So particularly they have something here called phased payment. So this is this idea about you might have maybe 2 work packages. You get the money for one year and the money for the other the second year. So it's staged payment. So you need to detail what you do and which point. And then all the signatures and declarations at the end. So that's very clear. It's an online form. There's only little bits of words, which in itself is a challenge, but it's quite straightforward. It's a completely different ball game when you get to the bigger, strategic, larger funding applications. So try a couple of those smaller ones first. If it's your first time in, I wouldn't say go for one of these massive ones straight away, because they're so much more complex. So generally, the more money, as I said, the more complex it is. So there's a whole abstract here, 500 words, just sort of summarising the whole project. Often you'll be asked for a plain English summary or a lay summary. So imagine you're explaining to a member of your family that isn't a biomedical scientist what you're going to do. That's the kind of language that you need to use. You may need to be talking about patient involvement in some of your studies as well, so that's quite important. Then there's all of the detail of the research plan, and the word count for each of these sections will vary depending on the funder and the scheme. But you can see it's the kind of things we've just talked about. So there's the background, the aims, the methods, outputs, ethics, all of those things you'll have to write an extended piece of text for. But there's also a bit of a sting in the tail. So often they want extra bits and bobs outside of that word limit. So here they might want a list of references separately, which is good. It saves you words in the main bit. But it's a killer if you're working to deadline and you suddenly realise you need a separate list of references. So that needs to be ready. You might need your data management plan. You might need detail of NHS costs, particularly if you're doing patient analysis. Might be letters from trials units, things like that, or further supporting information. So you need to have all of that ready, and it all takes time. And I think the thing that annoys me the most when you put grant applications in, but it's quite a good tool. It's a project management tool called a Gantt chart. I'm sure you all know what this is, but just in case, it's a way of visualizing the aims of your project and how they evolve over time. So the funder knows what you're going to do when. And there's generally 2 types of approaches. So here we've got, it doesn't matter what the project is, but we've got 3 work packages. We've got names. I know it's teeny, I apologise. Names of the people that are going to do it, and then how long each bit is going to take. And then this aim feeds into this one, which feeds into this one. And often you'll have little things like this, which are when a thing will be created or there'll be an output. Might be a paper, might be a conference, might be a clinical guidance document, whatever the hell it is. So this is a really clear way of articulating it. The problem might be that you could perceive risk in this, because if this one doesn't work or overruns, then it has a knock-on effect on everything downstream. So you sometimes see Gantt charts like this, where there's a bit more overlap in the objectives. Again, there's different people, so the people here in orange, different elements of the work package, but it's a bit more overlapping. So it's a bit more flexible and sort of resilient as a plan. So you might see these kind of things, but in essence, what they're doing is saying who's doing what to address your aims and when are they doing it? Where is there an element of reviewing or outcome assessment, that stop, no go type decision, when are they going to happen? So it makes it really clear for that busy person on the committee that hasn't properly read your grant, they can have a look at it and see exactly what you're doing when. So reasons you might not get through. So particularly I'm talking about early, sometimes you have 2-stage appraisal. So it might go to somebody in an office who just checks that the grant is compliant. If it is, it then goes to the review panel, or it may go to internally to your institution and then go for submission. And they're usually obvious things. So you haven't got the right attachments. There's something about the PIs or the partners on the team, they're not eligible, or they're not somewhere where you can apply for this. Finances are wrong, doesn't fit the scope of the call. Maybe there's a cap to the number of applications and you've missed it, or you've missed the deadline. So they're all obvious things that will stop you going to the next stage. Sometimes for grant applications, you have that initial triage. It then gets sent out to external experts who are really experts in your area. They make comments on it, and then the committee looks at your grant, the comments from the reviewers, and possibly, if you get chance, your chance to rebut what the reviewers have said. And these can be horrendous sometimes. In all honesty, you sometimes think, well, clearly that reviewer's mad, but I wouldn't put that in the letter when you go back to the grant. So stay calm and positive when you read those comments, and probably read them, get the sort of anxiety out the way, put them down, and then come back and read them again. You have to rebut them to the funding committee. So don't just focus on the positive things. Oh, it's great, all the reviewers really like my grant. They can see that, they can read it in the comments. What they actually want you to do is, where there's any misunderstandings or where they've said that something you're going to do is not quite right, this is your chance to rebut that. Say, actually, I am right because, or actually, I've already de-risked this and here's the data. So it's a chance for you to show you can do it. Be as positive as possible in those responses. Sometimes it's hard, but be as positive. And my advice would be sleep on it before you send that email, just so that you can kind of down-regulate yourself the next day. And then this comment about funding panels I've made earlier. So they may be made up of people from different disciplines than you. So sell your grant to the people who aren't experts in your area. If they understand it, then it's the right level of clarity. I've got to be realistic. There's a whole field of research into how grant committees work. Funders love them because it's a chance to poll a wide variety of opinions to help them in their decision making about something being funded or not. But those committees can sometimes be biased by particularly shouty members of the committee. So the chair should fix that. A good chair will sort that out. But sometimes a decision will be made and you won't like it, but there's nothing you can do with it. It's just the way the committees works. And sometimes it's because they haven't all read your application in detail. So they're relying on the person who's presenting your application to the panel. And if it's not clear and they can't describe it clearly, you're less likely to get funded. So the panels can sometimes fixate on misinterpretations or details that aren't quite right. So be really careful about how you put it together, because at the end of the day, they are human and fallible. So bear that in mind. And then last couple of slides. So if you are successful, well done. It's a tough climate, celebrate those successes. But before you go out and start planning your experiments, bear in mind that it takes time from when you get the yes from the funder to the money being in your hands so you can do what you want to do. You may need to get your account set up internally. You may need to employ people. You may need to get contracts in place before you start doing something. So build that into your work plan. If the decision for the funding is going to come out in May, maybe say in your Gantt chart that you're not actually going to start the grant till August, because that gives you time to get all of the ducks in a row so that you can then start. It means it's all of these approvals aren't eating into your time when you should be working. And then last message, if you're not successful, happens to the best of us. Some of it's just out of your control. So reflect on it. Often you can repurpose your grant. This is where those grant program managers are helpful. They may suggest where you can send it. You need to learn from that experience. Often you can repurpose bits of information, things like data management plan you could use in another grant. So, use what you can, learn from the experience, and onwards and upwards. And remember that all of us fail to get grants. So you're not alone, essentially. So just to summarise what I've said before we have questions, I guess my key tips for success when you're all hopefully putting lots of grants in is engaging with your partners and stakeholders early, just so that you can get all your ducks in a row. Take care to read the guidance documents from the funder so you don't make a really simple goof because you haven't done the right things. Give yourself enough time to put it together. You've all got busy, clinical jobs. You might be writing this out of hours. It can take, up to a month for a short application. It may be 6 months or more for one of those big monster applications. So give yourself time, but also give your partners time to give you what you need. And really, the longer you take to prepare, generally, the better. You can be better informed and better prepared. And then my final tip would be, don't submit it at 11:59 on the last day when it's due at 12 o'clock, because there may be technical hitches. You may miss that admin sign off and miss the deadline. The funder web traffic will be massive and you might not be able to get it submitted. So try and do it early, if at all you can. And I think that was the end of it. So I'm going to stop sharing if I can remember which button it is. There we go. And hopefully take some questions.
Thank you, Trish. That was really useful. I can't see any questions in the chat, but if anyone wants to ask a question, you can raise your hand and I will manually unmute you and then you can ask your question. But I do have a question, Trish. So
yep.
Do you have any experience or know of any kind of situations where an application has been submitted and it's not been successful, but then has been successful elsewhere? So it kind of, you know, have you been involved in kind of mentoring someone in applying for something where they haven't been successful and then they've gone away? And could you mind just sharing a little bit about that? Thank you.
So that's not uncommon. That was a message I would give all of the audience. It's not uncommon that that's the case. So one classic example of that is our lab is, as I said, quite mixed discipline. We have clinical researchers who are maybe physicians who are not quite consultants yet, but they're going to take time out of their program, do some research, and then hopefully get a PhD and then go back to being a clinical academic. And there are various funders for those types of PhD money. So the NIHR, Wellcome, MRC, and then also some research charities. So most people go for the big sexy ones first. So they'll go to Wellcome, they'll go to MRC. It's a really complex application. You get shortlisted, you have to have an interview. It's quite a stressful process to go through it. So we have lots of internal triage at the university. We'll run dummy grant clinics, we'll give them mock interviews, we'll give them feedback on that application, but sometimes it just won't make it through, say, Wellcome. And it may be because of how much funding is available, they just don't quite score highly enough. But then there's often situations where those researchers can then repackage that grant to perhaps a specific research charity. So we work in the liver diseases space, and there's something called the British Liver Trust, there are British Society of Gastroenterology, there's all sorts of other kind of research funders and associations that might fund those kind of applications. So we've seen people that have gone from not getting a Wellcome to getting a research charity, Rose Trees or something like that. Or we have NIHR infrastructure funding in the region. So we may be able to, because those people are part of our NIHR infrastructure, they then become eligible to apply for the NIHR grant schemes. So we've then mentored people to go through and they've successfully got early kind of NIHR startup fellowships, things like that. So there's always ways that with the right support around you, you can move from one funder to another, essentially.
Thank you, Trish. So previously in a council meeting, we've kind of discussed a mentorship for people wanting to apply for research grants and that kind of thing. And we have discussed the possibility of, the IBMS mentorship scheme that they've got, kind of using that as an approach for anyone interested in applying for research grants. Can you suggest or point anyone in the direction of any other schemes that might be available?
Sure.
I'm just thinking we could share that maybe with the recording afterwards and can
absolutely.
Thank you.
So the two that I'm aware of, so again, apologies, it's biased towards my discipline, but the Academy of Medical Sciences has a mentoring scheme nationally, which you can apply for. Also, the National Institute of Health Research has a national mentoring scheme. And it's interesting because NIHR in particular has a lot of funding schemes for people that might represent your academy. So allied healthcare professionals is a blunt term, but it's people working in a lab context, physiotherapists, radiotherapists, people who aren't medically, a doctor, but are working in medical disciplines. There are specific mentoring schemes for those kind of careers. And it's hugely valuable because your mentor will be much more senior than you. They may have sat on grant committees, so they can give you feedback on things that you wouldn't necessarily have thought of when you're putting those applications together. But also they can point you in the directions of funding pots of money that you may not have thought about, and maybe even put you in touch with somebody who could become a partner on your grant and help you deliver it. So yeah, it's definitely, I'm really pro mentoring scheme, so people should take opportunities if they get them.
Thank you, Trish. The other question I had was kind of, as biomedical scientists, we're usually working on the bench, processing patient samples, and that's all we have time for.
Yeah.
But I know of stuff like I've stepped into academia now after working in the labs for 12 years, but I know of people who work in the lab as a biomedical scientist, but also have an interest in research, but they just don't have the time because of their full-time role.
Yeah.
Do you have any ideas of how they could maybe, how they could maybe fit in research into that daily role? I'm aware there's lots of different types of things, but maybe some of the younger junior biomedical scientists might not be aware of how they can get involved in research. So I just wondered if you had any ideas.
So it's very much dependent on that role and also your managers in that particular infrastructure you find yourself in, whether the managers are supportive of research. So that's the first challenge, is supportive managers. If they are, there's different ways you can get in. So often you could be a co-applicant or a part of somebody else's grant application. So you may be delivering, as part of your daily work, a particular analysis of a set of samples on your kind of assay systems that feed into somebody else's application. You then get on those publications. You perhaps have some FTE, so some costed credit on that grant application, which will buy you some time. If you've got a supportive manager, maybe you could get a day of a week to actually do that research side of things. And then that allows you to get a little bit of a research pedigree, so maybe a paper or an abstract, a conference, a little bit of time. And then that allows you to apply for this sort of more pump priming or research grants for yourself. So there's some really nice schemes. Again, apologies, NIHR is an example where they offer grants for early, people, exactly as you mentioned. So early BMSs, for example, who want to get into research, they don't know how to do it. The NIHR may fund some of your time in these pump priming things. So you can go back to your manager and say, look, I can get funds for a day of my time. It'll backfill for you. So somebody will do that role, and that will allow me to engage in my own investigations. So probably I would say is start small, get the buy-in from your manager, and then look for these kind of pump priming or startup lift off, they're sometimes called. Birmingham Health Partners, our region, offers some of these kind of startup type fundings to allow people to actually engage in that research process. But often, and I probably didn't stress this enough when I was talking, it's about your networks. So if there's a really good physician, academic physician in your area, or a really good scientist that works with your team, and they have opportunities for research, you want to approach them and ask them for support, because it's very difficult, I think, as a junior to get the pedigree to establish yourself as a researcher. So you want to work with good mentors and good teams around you, really.
Thank you, Trish. I can't see anyone with their hands raised or any questions in the chat. I wondered, Dan, because I know you've been involved in some research as well. Have you got any examples in your team of where people have been involved, like working on the lab floor? Any ideas that you can maybe share with people who joined?
As Trish says, it all comes down to having a manager that's supportive. We're very lucky here in that we're fundamentally a research department, so we can encourage our staff to be involved with research. So we've got a lady who works in our data team who's recently presented a poster at an international conference over in Krakow. But we're very lucky in that regard, in that we've got time to dedicate that. In my former life in Cell Path, where we were a very much service delivery diagnostic lab, it would have been much more difficult to free up time for that in that situation. So it can be done. If you can bring in money to offset your time, that's a really good leveraging tool with your manager. Very often trusts will have a large commitment to research and development. It's just getting yourself in those groups of people and networking with research nurses or with the R&D teams and offices to try and extract yourself from the diagnostic bench and put yourself into a more research position. Real tough thing to do though in most diagnostic labs. Yeah,
that's what I find. Tough to do kind of your full-time role as well as anything else.
Absolutely.
Never mind research. Yeah. Okay, well, thank you. I don't see any comments in the chat, so if no one has any more questions, I don't know if there's anything else that you want to share, Trish or Dan. I finished a little bit early today.
Yeah, I think we've probably covered everything. It's all about, as I said, networking, preparation, and just as an academic, and I know my clinical colleagues, we're always interested in people who want to do research. So it's often a case of, I know it's really difficult if you're very humble to put yourself forward, but just, you never know, that little conversation at the coffee machine or whatever. Oh, I saw that thing you did. I'm really interested in research. Have you got any opportunities? It's hard to do that, but sometimes that will pay dividends, and somebody will say, oh, actually, I have got this project. And that's what happened with the example that Dan has just given. One of our academic physicians working in the space of, I think it was alcohol, wasn't it? It was Neil, was interested in a particular issue they have around what's happening to some of their patients on the waiting list. And our particular data person was able to go into the databases and extract that kind of information that was available, and then it all got worked up into this project and she was able to present. So sometimes it's just about putting yourself out there, and there is, luck plays a part for sure, but you need to put yourself in a position to generate that luck, I think. So just, chatting to people and networking is a really good thing to do.
Yeah,
I guess sort of tying into that, not all research has to be wet practical work.
Yeah.
Some of it can be, dry data related or, interpretive type stuff that doesn't necessarily involve having spent time at the bench. So there are other ways to start small and build, rather than just expecting to be able to go into a lab and do some, state-of-the-art type experimentation. Doesn't always have to start big.
Yeah, that's interesting actually, because I think that's what people generally assume, don't they, that you've got to be involved in wet lab practicals and that kind of thing, but actually you can generate data from a dry project as well. Yeah.
And there's just as much value in them. There's huge banks of data out there that are underutilized, and actually you can deduce some really interesting information from them with the time and effort.
Yeah. Thank you. That's been really useful. I've learned quite a lot myself. So yeah, thank you so much for your time, Trish and Dan, and for everyone else who's joined. As I mentioned earlier, the recording will be made available, and I put together a couple of links that I put in the chat, which we can share when the recording goes out. And Trish, I'll reach out to you to get links for the mentorship schemes that you mentioned, if that's okay.
Remind me. Yeah, that'd be great.
Right, well, thank you everyone for your time, and have a good rest of the day. Enjoy the sunshine while it lasts.
Thanks all.
Thanks everybody. Bye.
Bye.